Hepatitis B. Hepatitis B is a liver infection caused by the hepatitis B virus, HBV, that can be either acute or chronic. It's a serious health concern, as chronic hepatitis B can lead to serious complications, like liver failure and liver cancer. Let's take a look at its key aspects. Genome of hepatitis B virus. Hepatitis B virus is a partially double-stranded DNA virus. Transmission of hepatitis B. Hepatitis B is primarily transmitted through contact with infected blood and other bodily fluids, like semen, vaginal fluids, and saliva. It can also transmit from mother to child during birth. Incubation period for hepatitis B. The incubation period for hepatitis B is the time between exposure to the virus and the appearance of symptoms. It typically ranges from 1 to 5 months. The average incubation period is around 90 days. Disease pattern of hepatitis B. Hepatitis B can manifest as either acute or chronic infection. In adults, about 90% of hepatitis B infections are acute. The remaining 10% or less will progress to chronic infection. Acute HBV infection is a short-term illness, typically lasting less than 6 months, where the body's immune system usually clears the virus. Many people do not experience any symptoms. Some may experience symptoms like fatigue, nausea, vomiting, abdominal pain, and jaundice. Chronic HBV infection, on the other hand, is a long-term infection lasting 6 months or more, where the virus persists in the body and the immune system is unable to clear it. Chronic hepatitis B can lead to serious long-term complications, like liver damage, cirrhosis, and liver cancer. Complications of hepatitis B. Chronic hepatitis B can lead to serious complications, like cirrhosis. Long-term inflammation from chronic hepatitis B can scar the liver, thus leading to cirrhosis, which can interfere with the liver's ability to function properly. Liver cancer. Chronic hepatitis B is a leading cause of liver cancer, also known as hepatocellular carcinoma. Liver failure. In severe cases, chronic hepatitis B can lead to liver failure, where the liver can no longer perform its functions. Prevention of hepatitis B. Hepatitis B is preventable through the following methods. Vaccination. Hepatitis B vaccination is highly effective in preventing infection. The vaccine is safe, available, and offers near 100% protection against the virus. The World Health Organization, WHO, recommends that all babies receive the hepatitis B vaccine as soon as possible after birth, followed by 2 or 3 additional doses. Safe sex practices. Avoiding shared needles. Mother-to-child transmission prevention. Screening pregnant women for hepatitis B can prevent transmission from mother to child. Avoiding contact with infected blood and body fluids. Hepatitis B is spread through contact with blood or body fluids, so avoiding sharing personal items like razors or toothbrushes, and being cautious about tattoos and piercings in reputable settings, can reduce the risk of infection. Treatment of hepatitis B. The treatment of hepatitis B infection depends on whether it is acute or chronic. Acute hepatitis B. There is no specific treatment for acute hepatitis B. Treatment for acute hepatitis B, which typically resolves on its own in adults, focuses on supportive care, which includes rest, hydration, and proper nutrition. Chronic hepatitis B. Treatment for chronic hepatitis B aims to slow down the progression of the disease, reduce liver damage, and prevent complications like liver cirrhosis and liver cancer. This includes antiviral medications, interferon shots. In conclusion, hepatitis B remains a global health challenge, but it is both preventable and manageable with the right interventions. Thank you for your attention.